Are you a high school or college student interested in getting into medical school? I'm going to tell you what you need to do. When you start college, what major should you pick? Here's the best answer. Pick whatever you want. It's a common misconception that you have to have a science degree to get into medical school. So not true. Nowadays, people are getting degrees in art, science, music, education, anything. So truly pick whatever your heart desires, whatever you're going to do well in, and something that you enjoy. The next thing, I want you to find your career advising center. A lot of bigger colleges will have a pre-professional advising center or some kind of pre-professional advising mentor. This person is going to be your go-to person in terms of questions about medical school, about what you should be doing to prepare. So start a relationship with that person early. The next thing I want you to do is do a little bit of research on what the timeline looks like for medical school. So you don't have to decide this now on whether or not you want to take a gap year or you don't want to take a gap year. Not super important right now. But as time goes on in college, you're going to need to know the timeline. If you plan to go straight through from college to medical school, you need to be taking your MCAT a little bit earlier so that you can apply during your senior year of college. I can make another video on med school timeline and application timeline, but just so you know, the application season is just about a year long, so you need to prepare for that in advance. As a freshman in college, it's a big learning curve on figuring out what studying methods work for you, so the most important thing is doing well in your classes. Now, if you've already got that down, I'm going to suggest that you start looking for your extracurricular activities. So when you're getting into medical school, schools are looking for research, volunteering, clinical experience, shadowing, things like that. So you should start looking for those opportunities as early as you can. If I were you, I would start with shadowing, because shadowing is going to give you a good idea if this is definitely the career path you want to go down. It would be terrible to get a few years into college and think you want to do medical school and then shadow for the first time and realize being a doctor is not what you wanted to do. So I think doing that early is the best thing you can possibly do. So this next tip is something I wish I had done, but I'm going to suggest once you start clinical experiences that you go out to the store and you buy yourself a little journal. In this journal, I want you to write about your clinical experiences. So that can be specific encounters with patients or other healthcare members of the team. This little book will become so helpful when you go to write your personal statement for medical school, when you want to write about your extracurricular activities, when you're writing your secondary essays. It's something I really wish I had done. So please do this for me. So also a huge thing is finding out what interests you in terms of extracurricular activities. It's okay if you don't want to do research. I got into medical school and I didn't have a first authorship publication, or I didn't have abstracts, I didn't have poster presentations. If you are gunning for a research-heavy medical school, it might be helpful to have that on your AMCAS application, but it's not a necessity. If you're more interested in service and leadership and tutoring, look into things that you can do in those areas that you're passionate about. Because I'll tell you this, when you're in interviews and you have information on your application, people are bound to ask you about those experiences. If you actually enjoyed those experiences, they're a lot easier to talk about than something you did that you really didn't enjoy or get anything out of. And people can tell when you're being genuine about that stuff. So I'm telling you, do what interests you, but also make sure that you have all your bases covered in terms of different parts of your application and the diversity of your application. And of course, work hard in class, make solid friendships, get to know professors, connect with some clinical mentors if you have time, and it's college, so have fun.